Hi there, I'm Dr. Megan Yim at BackFit Chiropractic here in Victoria, and today I'm going to be talking about sciatica. So sciatica is a common symptom associated with lower back pain, and it is characterized by even more intense pain that goes down into the leg. The quality of the pain can range from really sharp, electrical, or can be even more dull, achy sensation. The source of the pain in sciatica is in the lower back though. It's an irritation or pressure on one of the nerves called the sciatic nerve originating in the lower back. Now there is a few other diagnoses that can be confused with sciatica that comes from the lower back, and that includes things like spinal stenosis, which is more associated with degenerative change within the lower back. It can be confused with something called piriformis syndrome, which is compression or entrapment of the sciatic nerve as it passes under some of the deep glute musculature. And it can also be confused with more of a referral pain that can come from a joint or a muscle within the lower back, the glutes or the legs. So when we're talking about sciatica, we're exclusively talking about pressure on the nerve that stems from somewhere in the lower back. And usually that is compression, bulge, or herniation of a disc, which will decrease the space that this nerve has to exit through. This is an example of how a disc herniation would put pressure on the nerve. Now there's several different parts of the nerve that can be affected. Number one is the sensory part of the nerve. If that one is irritated, then what you'll feel is pain that can go down into the leg. As it advances, it can become a change in sensation, in which case it'll feel like a tingling, maybe an electrical pain, or even get to the point of numbness. The second part of the nerve that can be irritated is called the motor part of the nerve. And with that part of the nerve, what you'll feel is really tight, tense muscle, potentially a cramp or a spasm sensation, and sometimes you'll even experience weakness in the lower back, the glute, or the leg. Now with sciatica, generally speaking, it will be affecting one side, and what you'll feel is symptoms that go kind of in strips down the leg as opposed to the entire leg being affected. Several treatments can be used to relieve the pain associated with sciatica. Number one that we use here at BackFit for particularly a disc-related nerve pain is called decompression therapy. With decompression, the patient is placed on a table with straps around the hips as well as the rib cage, and there's an oscillating force where the table basically distracts the lower part of the body to get pressure off of the nerve and rehydrate disc material. The second type of treatment that we offer here at BackFit is called chiropractic alignment care, and that includes a combination of muscle work, joint mobilization, as well as some chiropractic adjustments depending on the person, on the patient, their preferences, as well as the diagnosis. The main thing that I want to talk about today is exercise that can relieve symptoms of sciatica. Now, when we're starting off with a rehabilitation program, the main focus is always to relieve the pain. So taking on positions or movements that relieve the pain and even centralize the pain. So what I mean by centralization is, as a symptom or a nerve irritation gets worse, you'll feel it go lower and lower down into the leg. As it heals and gets better, what we want to see is the symptoms creep back up from the leg back to the source of origin in the lower back before alleviating altogether. So with these exercises, stretches, and positions, what we're aiming for is pain relief and centralization. Once that has been accomplished, then we'll focus on motor control exercises where we work on preventing those symptoms from occurring again. The following exercises are a few examples of pain relieving positions and movements. I really want to emphasize though, the pain relieving positions depend on the patient. So, one exercise may be much more relieving for you than another. Focus on the exercise that relieves pain for you. Everyone is different in their presentation and in what positions will be accessible and relieving. First exercise, start by lying on your back with your knees bent. Slowly draw one knee up at a time towards the chest. You can draw the knees in even closer by grabbing on with your hands. Depending on your tolerance, you can rock side to side as well. Second exercise, lying on your back with your knees bent. You're going to slowly drop the legs from right to left. Nice and slow and controlled movements. Depending on tolerance, you can drop your legs further and further towards the floor. Third exercise, start lying on your back with your knees bent. Draw your heel across the opposite knee. You can slowly bring that knee up towards your chest, grabbing on with your hands to make the stretch a little bit deeper. Last exercise, flip onto your stomach. Place the hands directly under your shoulders, lengthen the spine, keeping the gaze on the floor, press the chest and head up off the floor. And stop. Oftentimes with sciatica, tilting to one side will be more relieving than tilting to the other. So in order to determine this pain relieving position, stand beside the wall, place your elbow up on the wall parallel to your shoulder, and then slowly dip your hip towards the wall. One side may be easier than the other. Only go as far as is tolerated, so flirting with the edge of discomfort, but not pushing into that discomfort. Thanks for joining me today talking about sciatica and particular treatments and exercises that can help relieve pain. Please stay tuned to learn more about musculoskeletal related treatments and exercises.